Question number 1. As a nursing officer in the labor ward, which of the following is not a part of active management of the third stage of labor? Option A. Administration of oxytocin. Option B. Uterine massage. Option C. Yearly cord clamping. Option D. Controlled cord traction. The correct answer is option C. Yearly cord clamping. Active management of third stage of labor is a set of interventions designed to reduce postpartum hemorrhage and ensure efficient placental delivery. The three key components of active management of third stage of labor include administration of uterotonic drug, for example oxytocin, within 1 minute of birth to promote uterine contractions. Controlled cord traction to assist in placental expulsion. Uterine massage after placental delivery to maintain uterine tone and prevent excessive bleeding. A delayed cord clamping is recommended by WHO to improve neonatal outcomes, including better iron stores and reduced risk of anemia. Yearly cord clamping is not a standard part of active management of third stage of labor and is discouraged unless medically indicated. Question number 2. Which contraceptive method used during lactation except option A. Copper T, option B. E-pill, option C. Mini pill, option D. Combined OCP. Correct answer is option D. Combined OCP. Estrogen containing pills like OCP should not be used during lactation because it depresses lactation. Question number 3. Subacute sclerosing panencephalitis is a rare but fatal complication of which of the following diseases? A. Measles, B. Rubella, C. Chickenpox, D. Dengue. The correct answer is A. Measles. Subacute sclerosing panencephalitis is a progressive, degenerative, and fatal neurological disorder caused by a persistent infection with the measles virus. It typically appears 68 years after the initial measles infection, especially in children infected before 2 years of age. The virus remains inactive in the brain and later causes inflammation, seizures, behavioral changes, and cognitive decline. Measles vaccination is the most effective way to prevent subacute sclerosing panencephalitis. Question number 4. Which of the following cause for post-traumatic stress disorder except A. Divorce, B. Robbery at gunpoint, C. Bank corrupt, D. Diagnosis of cancer? Answer is bank corrupt. Bank corruption is generally not a direct traumatic event. It is not threatening life or physical safety. It may cause financial stress but does not fit typical post-traumatic stress disorder triggers. Question number 5. Why is boiling usually not preferred as a method of sterilization for stainless steel surgical instruments in the operation theatre? A. Damage, B. Corrosion and spotting, C. Rust, D. All of the above. Answer is B. Corrosion and spotting. Boiling kills many microorganisms but is not reliable for sterilization. It cannot destroy bacterial spores which are critical in patient OT safety. Corrosion and spotting occurs due to minerals in water and prolonged heat exposure. This leads to surface pitting, discoloration, and reduced instrument life. Stainless steel resists Rust because of its protective chromium oxide layer, so rusting is not typical in pure boiling water. Damage is also not a usual outcome of boiling. For OT use, autoclaving is the gold standard for sterilization in the hospital. Question number 6. All of the following are screening tests for cervical cancer except A. Colposcopy, B. Pap smear, C. Visual inspection with acetic acid, D. Cervical DNA. Correct answer is colposcopy. Pap smear, visual inspection with acetic acid, cervical DNA tests are all screening tools used to detect early cervical changes in asymptomatic women. Colposcopy is not a screening test. It is a diagnostic procedure performed after an abnormal screening result to closely examine the cervix using a magnifying device. Pap smear, a primary screening test detecting precancerous cells. Visual inspection with acetic acid, a low-cost screening method used especially in low-resource settings or rural communities. Cervical DNA testing detects high-risk HPV strains causing cervical cancer. Now consider a primary or secondary test. Question number 7. After a road traffic accident, a patient is brought to the emergency department. Following massive blood transfusion, which electrolytes imbalance is most likely to occur? A. Hypocalcemia, B. Hypokalemia, C. Hyponatremia, D. Hyperthermia. Correct answer is option A. Hypocalcemia. During massive transfusion, citrate used as an anticoagulant in stored blood binds to calcium in the recipient's bloodstream. This can lead to hypocalcemia, which may cause muscle switching, hypotension, or cardiac arrhythmias if not corrected. Question number 8. Which maneuver used to empty the urine bladder? A. Creed maneuver, B. Leopard maneuver, C. Burn Marshall maneuver, D. Gasping maneuver. Correct answer is Creed maneuver. It is a technique used to avoid urine from the bladder of an individual who, due to disease, cannot void urine without aid. The Creed maneuver is executed by holding manual pressure just over the anterior surface of the skin. Question number 9. Most common site of ectopic pregnancy. A. Isthmus, B. Ambula, C. Ovary, D. Vagina. The correct answer is B. Ambula. An ectopic pregnancy most often occurs in a fallopian tube, which carries egg from the ovaries to the uterus. Question number 10. What is the most common early symptom of aspirin overdose? A. Vertigo, B. Tinnitus, C. Lagrimation, D. Headache. Correct answer is option B. Tinnitus. The earliest and most common symptom of acute aspirin toxicity is tinnitus, which means ringing in the ears, often accompanied by impaired hearing. 11th question. Which site cannot be used for IM injection to prevent injury in sciatic nerves? A. Ventrogluteal, B. Dorsogluteal, C. Vastus lateralis, D. Deltoid. The correct answer is option B. Dorsogluteal. Dorsogluteal site, which means upper outer quadrant of the buttocks, is close to the sciatic nerve. Incorrect or deep injections here risk damaging the sciatic nerve, leading to pain, paralysis, or numbness. The 12th question. What is the most common cause of delirium on older adults? A. Long-term medicine. B. Alcohol withdrawal. C. Hypoxia. D. Dementia. The correct answer is D. Dementia. Dementia is the most common predisposing factor for delirium in older adults. Although not a direct cause, it makes the brain more vulnerable to acute stresses like infection, drugs, or dehydration. 13th question. Which solution causes the shifting of fluid from the cell to intravascular compartment? A. Isotonic. B. Hypertonic. C. Hypotonic. D. Diffusion. The correct answer is B. Hypertonic. Hypertonic fluid has a higher osmolarity than intercellular fluid. This causes water to remove out of the cells into the intravascular space by osmosis. Resulted, cell shrinks and vascular volumes increases. 14th question. A nurse is preparing to initiate peritoneal dialysis for a patient. What is the first priority action? A. Apply Foley's catheter. B. Auscultate and palpate for brood and thrill. C. Place a client in the left side lying position. D. Warm the dialysate solution. Correct answer is D. Warm the dialysate solution. Before starting peritoneal dialysis, the dialysate solution must be warmed to body temperature. This is essential to prevent abdominal cramping and discomfort, promote effective diffusion and osmosis, avoid vasoconstriction of peritoneal vessels. Gold dialysate can cause pain, poor absorption, and even hypothermia in sensitive patients. Option A. Foley's catheter is not routinely required for peritoneal dialysis. Option B. Brood and thrill is relevant to hemodialysis, not peritoneal. Option C. Left lying position may assist drainage but is not the first priority. 15th question. A patient with anterior medulla brain injury presents with deep, irregular breathing, hyperventilation, and episode of apnea. What type of respiration is most likely observed? A. Biot respiration. B. Kussmaul respiration. C. Chain stroke respiration. D. Eupnea. The correct answer is option A. Biot respiration. Biot respiration is characterized by irregular breathing patterns with variable deep and periods of apnea, typically associated with damage to the medulla oblongata, especially the anterior region. This pattern reflects a disruption of the brainstem's respiratory centers, leading to uncoordinated respiratory effort. Kussmaul respiration. Kussmaul respiration is deep and labored breathing, usually seen in metabolic acidosis. Chain stroke respiration, which gradual increase in depth of respiration followed by gradual decrease and then a period of apnea, which is called chain stroke respiration. Eupnea. Eupnea refers to normal, unlabored breathing. 16th question. Which of the following antitubercular medication has a side effect of pinkish orange color urine? A. Rifampicin. B. Ethambutol. C. Pyrazinamide. D. Isoniazid. The correct answer is A. Rifampicin. Rifampicin is known to cause pinkish to orange-red color in urine, sweat, tears, and saliva. This is harmless side effect, but patients should be pre-informed to avoid panic. 17th question. Which of the following drugs is contraindicated in patients with hypertension? A. Combined oral contraceptive pills. B. Labetalol. C. progesterone only pills. D. Levonorgestrel. The correct answer is option A. Combined oral contraceptive pills. Combined oral contraceptive pills contain estrogen, which can increase blood pressure by promoting sodium and water retention and enhancing vascular sensitivity to catecholamines. In hypertensive patients, this may worsen blood pressure control and increase risk of cardiovascular events. Therefore, combined oral contraceptive pills are contraindicated in women with uncontrolled or severe hypertension. Labetalol is actually an antihypertensive drug, often used in pregnancy-induced hypertension. Progesterone-only pills and levonorgestrel are generally considered safer alternatives for contraception for hypertensive women. 18 question. How long effective copper T318A? A. 10 years, B. 5 years, C. 3 years, D. 15 years. The correct answer is option A. 10 years. Copper T380A is a long-acting reversible contraceptive device. It is effective for up to 10 years once inserted. Copper ions released create a toxic environment for sperm, preventing fertilization. It causes changes in uterine lining to prevent implantation. 19th question. A patient is suffering from bradycardia, warm dry skin, and hypotension. These symptoms are suggestive of neurogenic shock. What is the other name for neurogenic shock? A. Cardiogenic shock, B. Distributive shock, C. Septic shock, D. Hypovolemic shock. The correct answer is B. Distributive shock. Neurogenic shock is a type of distributive shock caused by loss of sympathetic tone, usually following spinal cord injury. This leads to vasodilation, resulting in warm, dry skin. Bradycardia occurs due to unopposed parasympathetic stimulation, unique among shock types. Hypotension is due to venous pooling and decreased cardiac output. The 20th question. A 2-year-old conscious child presents with aspiration and gasping. Ventilation attempts by the healthcare provider are unsuccessful. What is the next priority action? A. Start CPR, B. Abdominal thrust, C. High flow oxygen, D. Back blows between shoulder blades. The correct answer is option B. Abdominal thrust. In a conscious child with suspected foreign body aspiration and ineffective ventilation, the priority is to relieve the airway obstruction. For infants less than 1 year, deliver 5 back blows followed by 5 just thirst. For children more than 1 year, use abdominal thrust, which is called Heimlich maneuver, if the child is conscious and choking. However, if the child is gasping and ventilation is failing and foreign body aspiration is suspected, back blows are the immediate action, especially if child is still responsive. CPR is only initiated if the child becomes unresponsive and no pulse or breathing is detected.